Well, if you find yourself experiencing a knee injury due to an articular injury, cartilage injury in your knee, Dr. Tolin may have the answer for you. The San Antonio Orthopedic Group is conducting a study and they're recruiting patients that are experiencing knee pain. Dr. Tolin, talk to us about what is articular cartilage injury to the knee.
Articular cartilage, I'm going to show you on this model, is the surface that covers the bone in our joints. And so it provides a nice, smooth, gliding surface that your joints move back and forth. And so an injury can be a little crack or a little defect where there's a chunk of cartilage actually missing. And that can cause pain and swelling that can be very debilitating. The problem with these type of injuries is that cartilage has very little blood supply and a very limited capacity to heal. So these defects tend not to heal over time and can become progressively more painful and symptomatic.
Right. So you all have a study, a new NeoCart study, that is different from current treatments for this type of knee injury.
Yes, the current treatment for people that have a chondral defect or a cartilage injury, and this model actually shows what a cartilage injury is. It looks like a little divot that's all the way down to bone. The traditional treatment is a microfracture. And what a microfracture is, you poke little holes in the bone surface at the cartilage defect. It bleeds, it forms like a little scab over that area, and over time it matures into cartilage. The issue with the microfracture, which is the standard treatment for these type of lesions, is that it matures into a fibrocartilage. It's a repair type of cartilage. It's not normal cartilage. So over time, that deteriorates. We know that the failure rate with the microfracture can be over 5 to 7 years. The NeoCart is different than the microfracture in that you actually take your own cartilage cells and you send them to histogenetics, a lab that they grow them and they subject them under special conditions to try to create a more normal type of cartilage. And it comes back as a disc, so almost like a rubberized disc that you could cut and shape and fill the defect, fill the hole, like fitting pieces of a puzzle together. And the cartilage will grow and mature into a more normal hyaline type cartilage, which is the type of cartilage that we're born with and not a repair cartilage.
So for those that are at home, how do they know if they're eligible? Tell us who is eligible for this type of study.
We're looking for individuals with these type of injuries, and a lot of times you don't know if you have those type of injuries. But anybody that has a specific one-sided knee injury, pain, swelling, locking, may be a candidate for this. In patients, we're enrolling between the ages of 18 and 59.
That's wonderful. Well, thank you so much for this information, doctor. We hope to get you all some patients and improve their lives.